Hi everybody, my name is Divine and I'm going to talk to you about vaginal candidiasis, also known as a vaginal yeast infection. Now, vaginal candidiasis, which I will continuously refer to as a yeast infection, is caused by a fungus that resides inside of our normal flora in our body called Candida. Now, there's many different forms of Candida, but the most common form that causes yeast infections is Candida albicans. Now, how do we get these yeast infections? What causes yeast infections is when our other normal flora that resides inside of our body is not keeping the Candida in check, because inside of our vagina, there are different types of bacteria that balance each other out. And what happens is, if your other side that balances the Candida is not equally the same, the Candida will take that opportunity, since it is an opportunistic pathogen, to overgrow and cause an infection. Now, some symptoms that you may face while having an overgrowth of Candida includes having thick cottage cheese-like discharge, watery discharge, painful sex, itching, burning, scratching, all types of other things like that. It'll be very painful, red around the vagina, things of that nature. People who are at risk of getting an overgrowth of Candida and ultimately having a yeast infection are women. We're the demographic. We are the people most at risk. But the risk becomes even greater if you have diabetes, if you're pregnant, you have a weakened immune system. So examples of having a weakened immune system is having cancer, if you are HIV, if you have HIV, or you're taking antibiotics for whatever reason. Now, you may be wondering, why would antibiotics cause a yeast infection? Well, antibiotics, depending on which type, can completely take out all the bacteria that's in your body, or is a wide spectrum bacterial treatment, and it could imbalance the bacterium that you have inside of your vagina that normally reside there. So then it will cause a yeast infection, and you'll have to take another antibiotic to cure that yeast infection, well, antifungal. Diagnosis, usually your healthcare provider will diagnose it for you. So what they'll do is they'll ask you about your symptoms, see what's going on by also taking a pelvic exam and sticking that big thing, I don't even know what it's called, forgive me, inside of your vagina, spreading it open, looking at your vaginal wall, and also we'll look at your discharge and everything that's going on in there. And then they'll finish it off by performing a swab of your vaginal discharge and taking it to go and get cultured so that they can see which type of bacterium is causing your infection, if they believe that there is an infection going on down there in your no-no region. Treatment of this pathogen, this opportunistic pathogen, is taking antifungal medications. So some examples of antifungal medications are diflucan, which is a single dose that can be repeated every 3 days if the infection does not go away. Another over-the-counter method is taking Monistat and putting it inside of your vagina for a range of 1 to 7 days. And there's also a bunch of other creams that you can use, like ticonazole and stuff like that. Other methods, if those antifungal medications are not your forte, some people take vinegar and use it as a vaginal irrigation. Another thing that they'll do is take garlic pills to get rid of the infection. Also, You could use, I think it's boric acid suppositories. Boric acid suppositories. Forgive me. And then to prevent having this type of occurrence again, you could do things like wear loose-fitting underwear and clothes so that your vagina has room to breathe. Making sure that your vagina is dry and not wet. You don't want to have a wet under region because it can promote this type of growth. Another thing is not using scented lotions and soaps down there in that region. It can throw off your pH, and having a thrown off pH can in fact cause a yeast infection. Some other things to do is also keep very good hygiene, especially down there in your region. Now, having good hygiene is the preferred thing to do, you know, keeping your body clean, not nasty, but it's very important to keep it very clean down there to prevent stuff like vaginal yeast infections from occurring. Thank you for watching my TED Talk.